Going now to take up AB 776 by Mr. Levine. Without reference to file, the clerk will read. 1295. My apologies. AB 1295. The clerk will read.
Assembly Bill 1295 by Assemblymember Levine, an act relating to alcoholic beverages.
Mr. Levine, you may open.
Thank you, Mr. Speaker and members. I am pleased to present AB 1295. This bill is back on concurrence and creates a new craft distiller's license. This legislation allows small craft distillers to operate in much the same manner as wineries and breweries already operate under current law. AB 1295 has been the subject of negotiations on all sides, and I wish to thank the stakeholders for coming together on this legislation.
Mr. Jones, you're recognized.
Thank you, Mr. Speaker and members. I also rise in support of AB 1295. This is a very important bill statewide, but particularly in my district and in the county of San Diego. There are several craft breweries that are expanding into distilling, and this will allow them to expand, do more business, create more jobs, and have economic prosperity in California. I ask for your aye vote.
Mr. Linder, you may open.
Thank you, Mr. Speaker. I want to urge some support on this bill. I also wanted to just take a minute to acknowledge the hard work that my colleague from San Rafael has done with this piece of legislation. There were some speed bumps in the very, very beginning, but he was able to bring a lot of people together, and I'm proud to help support this and urge a aye vote. Thank you.
Dr. Weber, you're recognized.
Yes, Mr. Speaker, I too rise in support of this bill because obviously the author has done a tremendous amount of work, and given the fact obviously he is very drunk in love with beer, this is a good bill and I recommend an aye vote.
I'll assume there's no point of personal privilege on that one. Mr. Bloom, you're recognized.
Thank you, Mr. Speaker. I want to stand up in support of this bill as well, and every little drip, drippity drop of, that gets into the system. This is great for California. It's helping us along with our goals to provide a great playing field for all of the distillers and all the folks who are in this industry.
Thank you. Mr. Lackey, you're recognized.
Yes, Chair and members, even though I'm a non-drinker, I want everybody to know that I feel a little bit of pressure to be keeping up with the Kardashians, and I will be supporting this.
Mr. Gallagher, you're recognized.
Mr. Speaker, members, I know this bill really took a lot of time to finally get here, a little bit of turmoil, but finally made it here to this floor, so I'm very appreciative to see it get here. But like a fine distilled beverage, it takes a little time, it takes a little age, and now it's finally here for us, and it's peanut butter jelly time. So I'd urge your support for this important bill. Thank you.
Ms. Gonzalez, you're recognized.
I rise in support. I understand you have a lot of craft breweries in your district, probably a few more than mine, although we have some, but at the end of the day, my surfboard is bigger than yours.
Seeing and hearing no further debate, Mr. Levine, any closing comments?
I respectfully request an aye vote on this historic landmark legislation.
And with that, the clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. The clerk will close the roll, tally the vote. Ayes 72, no 0. The Senate amendments are concurred in. We will now take up AB 1164 by Mr. Gatto. Without reference to file, the clerk will read.
Assembly Bill 1164 by Assemblymember Gatto, an act relating to water conservation, declaring the urgency thereof to take effect immediately.
Mr. Gatto, you may open.
Thank you, Mr. Speaker. AB 1164 will help Californians reduce their water consumption on landscape irrigation by rolling back local ordinances that take away a homeowner's ability to install artificial turf for drought-tolerant landscaping. I ask for your concurrence in Senate amendments.
Seeing and hearing no further debate, the clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. The clerk will close the roll. Tally the votes. Ayes 67, noes 1 for the urgency. Ayes 67, noes 1 for the measure. The Senate amendments are concurred in. Colleagues, at this time, we're going to go to a couple of items that we had passed temporarily for. Going to file item 24, AB 533. The clerk will read.
Assembly Bill 533 by Assemblymember Bonta, enacting the healthcare coverage.
Mr. Bonta, you may open.
Thank you, Mr. Speaker and members. I rise to present AB 533, which is a vital consumer protection bill that protects patients from surprise medical bills. Surprise medical bills happen when an insured patient goes to an in-network hospital, lab, or imaging center, and unbeknownst to them receives treatment from an out-of-network physician. Under these circumstances, the patient receives a bill that is in the thousands, sometimes tens of thousands of dollars, when they have done everything right. This bill clarifies that in this situation, the patient owes only the in-network copay or deductible, not the surprise bill from the physician. Members, many of you may have personally experienced this phenomena or know someone who has. At its core, this is a very strong patient and consumer protection bill. In addition to protecting patients, members, AB 533 ensures that non-contracting physicians receive a fair payment for their services by requiring health plans to pay out-of-network doctors providing services at in-network healthcare facilities as a starting point, members, no less than what Medicare pays for those same services. This is a floor. This is a starting point for payment. It's a safety net. It is insurance for the doctor. So they will guarantee that payment at the minimum. The bill also, on top of that Medicare payment floor, requires the establishment of a mandatory independent dispute resolution process for an out-of-network provider who believes he or she should be paid more. That means they can go and make their case based on the specific set of circumstances and facts and their charges and their payments and the facts of the payment and reimbursement in their geographic area and say to an independent, non-conflicted arbiter, I deserve more. And that arbiter, that neutral, will make a decision and give that provider what is appropriate and fair under those circumstances. By basing the reimbursement in the limited and specific circumstances covered in this bill, and remember, this bill only covers those instances when patients are unfairly getting surprise bills. By basing it on the Medicare fee schedule, the legislature ensures that if physicians are being paid based on a transparent and publicly available database that we can all see, we all know what it says, we're starting from the same set of facts, and almost every physician accepts Medicare as payment in full in the state of California, especially those that provide hospital-based care. Many of you have been part of the effort that I have helped lead along with my colleague, Dr. Ed, in the Senate, to try to get Medi-Cal rates raised to Medicare rates. We fought hard for that this year. We'll continue to fight for that. 1/3 of Californians are on Medi-Cal, members. 1/2 of our children are on Medi-Cal. We're saying that Medicare reimbursement rates are appropriate for that significant population in our state. Surely then a Medicare rate can be a starting point for the discussion of what is fair for a doctor when the alternative is to provide, is to balance bill the patient in the thousands and tens of thousands of dollars. And members, to get to this point where we are today, we went through an unprecedented, deep engagement stakeholder process where literally in my office, with me present, I sat down with the leaders of CMA, specialist groups, the plans, CAPG, consumer protection groups, and others to talk about all the possible options on how to move forward. Many of you know, members who've been following this area, that this has been a vexing area of policy for this legislature, this body, not those of us who currently are here serving, but this body. Many attempts have been attempted and failed to address this issue. I think this legislature is on the brink of solving that vexing problem that has not been solved. We've done it in the right way, through a deep stakeholder process. We've done it in a way that has upheld the protection of the patient and the consumer. And we can make this a difference in the lives of thousands of Californians this year. Now, this issue has never been solved for many reasons, because it's difficult, because it's tricky, because the stakeholders don't always agree. And after being engaged in this stakeholder process, I'm convinced that it's nearly impossible, if not impossible, to make everybody happy. But the patients deserve a solution. And we've landed at a place for the fair provider reimbursement rate, which is in exactly the middle point. I submit the definition of what a compromise is. We've taken the extremes off the table that both sides dislike the most, and we've arrived at the two middle options, a Medicare-based approach and an IDRP, and blended them into a hybrid so that we have what is really the definition of a compromise here, members. Members, we have an opportunity to make right a fundamental wrong that many patients and Californians live today. I respectfully ask for your aye vote.
Seeing and hearing no further debate, the clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. Dr. Wood wanted to speak. Strike the roll. Thank you. Dr. Wood. Dr. Wood, you're recognized.
Thank you. I recognize to speak on the bill at this point?
Yes, you are.
Thank you very much. It is with reluctance that I rise in opposition to AB 533. I do not take this lightly. I agree with my colleague, Assemblymember Bonta, about the value of the bill and the need to develop a process that removes patients from a frustrating negotiation over payments. It is not fair or right for patients to receive surprise bills from physicians when the patients have done the right thing by going to an in-network hospital and doing their part to assure treatment is provided by in-network physicians. But nor is it fair to penalize providers who choose not to join networks for a variety of reasons. And yes, one of those may be reimbursement. But the reality is different plans have different requirements, and frankly, some of them are just a pain to deal with, and you don't want to do business with them. There is no incentive for the plans to inform patients about coverage. We just voted yesterday on SB 137 to provide adequate provider directories for consumers. There is a problem here, and plans need to communicate to patients better. The bill creates a scenario where they don't adequately provide information to patients and then penalize a provider for it by forcing them into a yet-to-be adequately defined dispute resolution process. The average commercial plan is approximately 50% higher than Medicare. To establish a dispute resolution process that sets the reimbursement for an out-of-network physician at the Medicare rate, unless the physician disputes it, pretty much guarantees that out-of-network physicians will be disputing virtually all claims, overwhelming a yet-to-be-developed process. I have always viewed healthcare delivery system and the primary components of it as patients, payers, and providers, as one that requires a delicate balance to assure that all aspects are treated fairly and the system manages to keep working. When the system doesn't work, the imbalance creates difficulties and tensions that we all hear about in our approach to resolve. One of the reasons this issue continues to come back over and over again. This bill resolves an unfair practice for patients, but creates an untenable situation for providers and creates an imbalance in favor of the plans and patients at the provider's expense, which isn't right. And I can guarantee you we will be approached to address the access problems that this bill will create in the future. I believe more time is needed to achieve a balance that works for all. Until that balance is struck, I must oppose AB 533 due to the provisions involving the dispute resolution process. This is a complicated bill. Based on the questions I received today, it is very confusing to a lot of people. Let's not unintentionally create an access to care issue with a solution that isn't balanced or fair. It was brought up that doctors do indeed accept, that who do accept Medicare actually do take it as payment in full. The reality is very few doctors these days are accepting new Medicare patients. It is a balancing act. You take Medi-Cal, you take Medicare, and you take private pay. That's how you survive in the world out there these days. To use Medicare as the floor, I think, creates an unfair balance in favor of the plans, and it doesn't help in the big picture in the long run. So I respectfully ask for a no vote.
Assemblymember Stone, you're recognized.
Thank you, Mr. Speaker and Chair. I want to thank the Chair of the Health Committee for spending the time and energy that it took to craft a real solution to a problem that's been around a long time. The issue of balanced billing hurts our constituents in a significant way on a daily basis. 1 in 4 Californians has received a bill that was a surprise to them that they are then struggling to pay. This bill is a significant step to protect constituents in a way that has been done in the Medicare and the Medi-Cal fields for a long time. It works in those situations. It can work across the board with all providers and make sure that our constituents have the benefit of the doubt in this circumstance and that the system functions fairly for the patients in this situation, for our constituents, and I request an aye vote.
Ms. Burke, you're recognized.
Thank you, Mr. Speaker. I rise in strong support of AB 533 to help protect our constituents from unfair billing practices. Members, we've heard from the opposition about how this is going to affect the bottom line of providers, but we need to remember this bill is about, the primary goal is, the main focus is protecting patients. AB 533 protects hardworking Californians, including those who often struggle to make ends meet and are doing everything they can to keep themselves and their families healthy. I ask you to think of your constituents who have undoubtedly received a surprise bill. I know I have. Thank you.
Ms. Gonzalez, you're recognized.
Thank you, Mr. Speaker. I rise, unfortunately, with deep concerns about AB 533. And I do appreciate all the hard work that I know that the author put into this. And I think we share, so many of us share on this floor, a desire to fix this very real problem. I can't imagine having to be in this position to not support this bill. I support it in health because there were ongoing negotiations. I support it on the floor the first time. There were ongoing negotiations. I felt good about that. But there is something about this bill that is very troubling. In a previous version of the bill, payments were going to be calculated with standard, non-contract criteria. But changing the payment mechanism to Medicare rate may have unintended, terrible consequences for both patients and providers. I see a troubling parallel with my many years of experience negotiating wages and labor benefits in contracts. If you set the standard rate so low at Medicare, there is no incentive for the insurance companies to even negotiate these contracts. This will increase the concern over network adequacy. I want to remain really involved with this issue. But this is for those of you who are at local government, have local government experience basically, and you remember that negotiation process. If you knew every time at impasse that impasse was going to be minimum wage, you'd get to impasse. Well, some of you. I wouldn't, of course. And impose minimum wage, because that puts you in a stronger negotiation process. The arbitration process that we heard about, we don't know what that even looks like. It's yet to be determined. So it could be baseball arbitration, it could be an open arbitration. New York State actually has an arbitration process that has worked. That wasn't put into this bill. This bill is a good start, but it needs to continue to work, and we need to prioritize this in January and get a bill that actually works, that isn't one-sided, that isn't lopsided, and that works for all Californians. I hope that some of you will stay off this bill with me.
Mr. Hernandez, you're recognized.
Mr. Speaker and members, as chair of the Labor and Committee, I rise in strong support of Assembly Bill 533. This is a bill to protect patients and working people. Doctors who practice at an in-network hospital must be required to disclose that they are not actually in the patient's network, or only be reimbursed at a network rather than out-of-network rates. Our constituents who follow their HMO's rules and go to an in-network hospital cannot afford to pay thousands of dollars when they think they did everything right, everything according to the plan. Surprise medical bills are contributing to the growing problem of consumer medical debt, a significant cause of personal bankruptcy in California and many of our households. Consumers should not have to pay the price for the complicated relationships between doctors, facilities, and health plans. We've heard the debate here on this table, here on this floor, that doctors and plans and hospitals are wrestling with this issue. But why should it be the consumer's fault? We are here as representatives of the public, particularly the most vulnerable. We are their advocates. We're their champions. The doctors, the lawyers, they have their lobbyists. They're in the hallway. They're dropping their cards. We are the ones that are here to back them up. I have a very close personal story on the same issue. About 2.5 years ago, my mother was taken in an emergency room. She was required to have an emergency surgery to save her life. The doctors told us it's a 50-50 that she make it out of the 6-hour surgery. It turned out to be a 9-hour surgery. The doctor came to my brother and I, police officer, legislator, and said, we've got 2 proposals for you, family. We can do plan A. It's the safest route. It's got the highest probability of survival. It's going to cost you $8,000 extra. $8,000 extra. And this is while she was being readied for surgery. Folks, this is happening to folks every day. I had to pull out a checkbook right there to make sure my mom was able to get the best opportunity to save her life right there. But what about for the average Californian that doesn't have $8,000, $20,000 ready to go within 15 minutes of a surgery? This is our opportunity to tell our constituents that we're going to stand up for them, and we're going to make sure that information is given to them properly, fairly, honestly. This isn't happening. That's why this bill is here before us today. I thank the author of this legislation for standing up for constituents. We know that there's strong moneyed interests on all sides fighting this, but the right side for all of us as California lawmakers is to stand up for our constituents. I ask strongly for your aye vote.
Mr. Cooley, you're recognized.
Colleagues, I rise in support of this bill. Colleagues, big numbers moving through any system are important to take note of. Often on this floor we hear about the silver tsunami, which is big numbers moving through the system. In the course of our career, there are just innumerable areas of public life where the cost of health care is moving through the system, and that curve, that trend, trying to bend that curve downwards is a matter of paramount importance that will affect us across our whole career in many, many sectors of public life. The truth is that there are few occasions when ideas come through the system that step on some toes but afford an opportunity to start bending the curve on the cost of health care and thereby attack one of the very big realities of our times that, as I say, affect us across the board. This bill addresses that. It does it in a way, I can assure you, that in the course of our career, as we try to bend the curve on health care, find ways to do it that are reasonable, that are measured, that are not unduly burdensome, it will always be an uncomfortable vote, but it was part of our responsibility. I think this is a very good bill. I think it was good here the first time. I think it's good as it comes back from the Senate. I urge your aye vote.
Seeing and hearing no further debate, Mr. Bonta, you may close.
Thank you, members, for the robust discussion and thoughtful comments. While we heard some debate about the payment structure and the appeal process for the providers, we must remember the main fundamental core component of this bill: protecting consumers from being trapped in the middle of billing disputes between health plans and providers when they've done everything right. This bill is about ensuring that our constituents throughout the state of California have access to affordable care and are protected from surprise bills from their physicians. Now, there's been some comments about the Medicare rate. Let me focus on that for a moment. The California Medical Association supports Medicare as a fair benchmark for reimbursing doctors, in that they've sponsored legislation this year, both AB 366 and SB 243, to put Medi-Cal reimbursement on par with Medicare. And remember what Medicare's role is in this bill. It's a floor. It's a starting point. It's a beginning point. The IDRP process, the independent dispute resolution process, is there for a special reason. It was very important to the providers. The plans were not happy with it. but it's in the bill. And it allows a provider to make his or her case to a neutral and raise their rate of reimbursement if they so deserve. And over the course of time, that creates a market correction so that providers who deserve higher rates will get those higher rates. And the plans, sick of losing an IDRP, will give those providers those higher rates. That's the purpose of it. In addition, members, this bill touches on a lot of different areas in the healthcare space, from contracting to reimbursement of providers, but it really applies to a narrow set of circumstances. Remember, when a surprise bill is given to a patient who's done everything right, and when the alternative is to stick that patient with a bill in the thousands or $10,000s of dollars, I think the process that we've come up for fair payment is appropriate. We've heard about access to care issues. There's a lot we can do in this state regarding access to care, and I've been working on many of those issues, and I'm committed to continuing working on those issues. Many of you have worked on those issues with me or on your own independently. They include strengthening our graduate medical education program. They include getting Medi-Cal rates up higher to Medicare rates. Many of you supported that. They include strengthening incentives for providers to serve in underserved areas, both rural and urban. The access to care issue is not going to be created or driven by a ban on surprise bills to patients. We owe that to patients and to consumers. Members, there's always going to be criticism of a bill of this scope and significance. Right now, we have an opportunity to make a difference. We have consumer advocates in strong support of this bill because it protects patients. We have the Labor Federation and labor groups and leaders in support because it protects their members from being unfairly treated. We have health plans in support because this is the number one criticism that health plans hear from their members. Members, we have an opportunity to do something today. We can make the so-called perfect the enemy of the good and remain stagnant and do nothing, or we can actually take action today to protect patients and consumers throughout the state of California. I respectfully ask for your aye vote.
The clerk will open the roll. All members vote who desire to vote. 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 Mr. Bonta moves a call. This item is on call. We're going to go to the next item we had temporarily passed on, which is file item 36, AB 1140. The clerk will read.
Assembly Bill 1140 by Assemblymember Bonta and others, an act relating to crime victims, making appropriation therefore.
Mr. Bonta.
Thank you, Mr. Speaker and members. Today I present to you AB 1140 for concurrence and Senate amendments. The California Victim Compensation and Government Claims Board administers the California Victim Compensation Program and compensates victims of specific types of crimes through their restitution fund. The board brought stakeholders together recently for the Statute Modernization Project to make recommendations on how to update the program, and this bill reflects those recommendations. There are a number of Senate amendments which include items like a requirement that the board send out the initial application materials in several different languages, and these come from Senator Hancock's SB 519. They have other changes that strengthen the bill. I respectfully ask for your concurrence in Senate amendments.
Seeing and hearing no further discussion, the clerk will call the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. The clerk will close the roll, tie the votes. Ayes 64, no 0. Senate amendments are concurred in. Moving now to file item 41, AB 1269. The clerk will read.
Assembly Bill 1269 by Assemblymember DeBobne, an act relating to alternative energy.
Mr. DeBobne, you may open.
Mr. Speaker and members, AB 1269 is back for concurrence. Senate amendments simply address chaptering out issues, and I respectfully ask your aye vote.
Seeing and hearing no further debate, the clerk will open the roll. All members vote who desire to vote. All members vote who desire to vote. All members vote who desire to vote. The clerk will close the roll, tie the votes. Ayes 63, no 0. The Senate amendments are concurred in. At this time, pursuant to Assembly Rule 77.2, I'm re-referring the following bill to committee, AB 1250, Assemblymember Bloom to the Transportation Committee. Colleagues, I have a couple of quick announcements. We're about to break momentarily. But first, I would like to take a moment to recognize two special services staff who are retiring, who are going to be retiring this year. Jim Davitt has been with the department for 29 years. He'll be retiring December 31st on 2015. And Rich Moore has been with the department for 12 years. He'll be retiring on November 30th, 2015. If we could please join them in thanking them for their service. Members, at this time, the following committees will be meeting during the recess. For the second extraordinary session, the Finance Committee will be meeting immediately after recess in room 444. For the regular session, the Business and Professions Committee will be meeting upon adjournment of the second extraordinary session Finance Committee meeting in room 444. So in room 444, first the Finance Committee for second extraordinary session, then B&P Committee. The Appropriations Committee will meet in room 437. The Health Committee will meet in room 4202. And the Human Services Committee will meet in room 447. And again, all committees will meet immediately upon recess, with the exception of the Business and Professions Committee, which will meet as soon as the Finance Committee of the second extraordinary session adjourns. And we will be recessing now for 90 minutes. We will be reconvening at 5:10. Again, members will be reconvening at 5:10. At this time, this House stands in recess.